Unfortunately, as a young adult male from the United States, I really had no place in telling them what they should do and what way they should go. The girls, there's 34 of them, the average age is 12. And as I told you, when I was 12, I was scared of other 12-year-old girls. And so, I had never experienced girlhood. Never experienced it. This speaks to an immediate mistake, though, that I made, and public health officials, NGOs, and researchers always make. We tend to ignore girls in public health, and when we do pay attention, we only focus on their genitalia. So, we at MG Initiative, we bought them a megaphone. We actually don't have a building or an office, but we have a megaphone. And the reason is we want the littlest leaders in our group, the girls, to tell us very loudly what their concerns. In a survey that we conducted in March using the Beck Hopelessness Index and the Gender Equality Index, a survey, we found that all the girls scored really high in their future orientation, the ability to just plan out what they see, where they see themselves. However, when we asked them qualitatively what their dreams were, quite a few said they merely wanted enough to make enough money to pay their parents' medical bills. And Vietnamese girls have a certain beautiful role. They feel like they need to serve their family at all costs. At the same time, they're expected to take care of the ill family members. So the thing about these girls that was really special is they, in their neighborhoods, they know who uses heroin, they know who smokes whatever they're smoking, they know who's an alcoholic, they know who's eating what for dinner, and the best part is when you build a trust among the mentors, they're willing to gossip and tell you everything about what's going on with public health. And so they're actually quite the quite successful community health leaders in telling us what's going on in these neighborhoods and who, in terms of who's selling drugs, who's stealing, who's addicted, and who has HIV, who has AIDS, they know it all. So we shifted our program to be capacity and asset building. We recently celebrated our second anniversary 2 weeks ago. In that time, only one girl has dropped out. We started a leadership training club here. You can see girls from 8 to all the way up to 16. The 16-year-old and 15-year-olds are the ones organizing it. And we've also started savings accounts, which are basically, we open accounts and they tell us how much they want to save towards something they can open up when they're 18. Right now, we're looking to meet the current demand of other girls. Many households in these neighborhoods are now trying to get their girls in the program because they see how much it works. And I'm looking really quickly to anyone who's interested in finance, e-commerce, and development for help. And as a close, I'd like to challenge everyone to think about how middle school girls are scared. Not because their laughter makes you instantly insecure, because it does still, but because they can provide unique insights into what neighborhoods and themselves and become kick-ass community health workers. Thank you very much. Any questions you might have? I'm sorry I had to go really quickly, but any questions? Yes, in the back.
Could you speak a little bit more about the context of this? Is it a town or a village?
It's a city. It's a recently developed city, so it's only been a city officially for about 12 years. And basically, it's in the middle of everything. So it works as an economic hub for every other industry too in the area. So rice, fish, all this other stuff. Also works as a hub for human trafficking. So girls will go through Long Swing to be, trained or turned down, and to go to Ho Chi Minh City or to Phnom Penh.
So are a lot of them cross-border to Cambodia? Or
like Hannah said, the numbers are really hard to say. When I went to Cambodia, I did meet Vietnamese girls who are working in brothels, and Vietnamese women, but I couldn't tell you accurate numbers. I wouldn't feel comfortable doing that.
For the girls who don't end up going into prostitution to pay for their family's medical care, what other job opportunities are common or frequent, and to what extent? If these girls choose a different route, what routes are currently available to them without alternate intervention? And does your program pay any attention to helping them get into these other routes of employment? Because they do need to make a living.
Yes, and so a lot of girls are just too young to think about that point. When we did do the surveys and asked them, most of the girls, we're trying to see what they think they're possible of doing. So we separate it. They can say whatever job they want. We separate it to jobs that require post-secondary education and ones that do not. A lot of them either don't know. A lot of them are hairdressing, things like that, very basic service jobs. A lot of them have gone to the point where they've precipitated enough where they say, I want to become a doctor, a banker. We bring women who are in these jobs, so current bankers, current business women, we bring them to the leadership training, talk to them about the path it takes, the things it takes to reach that job. The oldest girls are 16, so they're not quite at the point where we would try to get them a job. They are working part-time jobs, and some of them, hopefully this summer, will start working for us officially as mentors.
Thank you.
Yes?
Where are you funded by?
Originally, Ford Foundation, the Get Part Institute at Washington University in St. Louis also gave me a grant. A lot of it is private donorship, so I'm trying to, the reason I asked about e-commerce is I'm trying to develop a way for the girls to say what they need, like we need bicycles, put it online, and for private donors to be able to fund that, crowdsourcing the donations, yes.
Do they go to school?
Yes, all of them are going to school now. If they want to drop out, we work with them to try to, if they want to drop out for a year, we try to work with them so to get back in, but none of them, only one has wanted to drop out. We work with the family a lot. Every woman in that household is a sex worker, and unfortunately she's working in a bar now. She's 15. It's something that the family just really wanted in terms of her contributing to the family income.
Do you do any work through the school?
Yes, that's one of our roles. All the mentors are trained in school advocacy. Yes.
What kind of theories have you used to develop it, and also what other interventions are out there that are similar to this that have maybe shown good outcomes?
So I'll answer the second question first. A lot of the programs out there now are involving rehabilitation. The ones that do involve prevention, they do focus a lot on like just giving scholarship and walking away and seeing what the girls will do, and those have huge dropout rates. In terms of theory, a lot of my theories are system dynamics. I do a little bit of that. And yeah, it's hard to say, because the public health part came really late in the game. There's a lot of it is social work theories, because my background is in social work. Yes. Last question, sorry.
Service, are there other service, I'm thinking of in this country, or Western European countries, Girl Scouts, Girl Guides, whatever, things like that do some of this, developmental stuff, career stuff?
No, because there is a kind of a
tradition of that.
Yeah, I hate to say it, but there is a kind of concept in some parts of the community that the girls are just stupid, so they can't do it. So that's my dream, that this will become a whole thing in Southeast Asia where it's basically Girl Scouts except cooler. Yeah. It's cool, but I want to be cooler. Thank you.
Mark, thanks a lot.